if you are taking amlodipine, losartan, or lisinopril right now, and most of you watching this probably are, I need you to stop what you are doing and pay very close attention to the next few minutes. Because what I am about to share with you today is something I wish every one of my patients had known before they started these medications. It's information that could mean the difference between these drugs actually saving your life or quietly making things worse without you even realizing it. Supplement. I have been practicing medicine for over 40 years. I have sat across from thousands of patients, good, hard-working people who were doing everything they were told, taking their pills every morning, going to their checkups. And yet, they were still having strokes, still ending up in the emergency room, still losing their independence far too early. Supplement. And in so many of those cases, the problem wasn't that they were taking the medication. The problem was what they didn't know about it. So today, we are going to fix that. Stay with me all the way through this video because the last 2 points I share with you could be the most important things you hear all year. High blood pressure, what we call hypertension, is one of the most common conditions I see in seniors. And I mean that literally. According to major health organizations, nearly 70 to 75% of adults over the age of 65 have high blood pressure. 70%. That means if you are sitting in a room with 10 of your friends right now, 7 of them are either on medication or should be. Now, medications like amlodipine, losartan, and lisinopril, these are genuinely life-saving drugs. I want to be very clear about that. Supplement. When used correctly, they reduce the risk of heart attack, stroke, kidney failure, and early death. I prescribe these medications regularly and I stand behind them. Supplement. But here is what nobody tells you at the pharmacy counter. Here is what gets glossed over in a 10-minute doctor's appointment. Supplement. There are critical things happening in your body when you take these medications. Interactions, side effects, nutritional changes, timing issues that most seniors are never warned about. And ignoring them can seriously undermine everything these pills are supposed to do for you. So let's go through them together, one by one. No complicated medical language, no confusion. It's the straight truth from a doctor who has seen what happens when people know and what happens when they don't. Supplement. The potassium problem. Your heart is paying the price and you don't even know it. Let me start with something that I genuinely believe is one of the most under-discussed dangers in blood pressure treatment for seniors. When you take a medication like lisinopril, which belongs to a class called ACE inhibitors, or losartan, which is an ARB, an angiotensin receptor blocker, one of the things these drugs do inside your body is cause your kidneys to retain potassium. That means your potassium levels can creep up higher than they should be. Now, potassium sounds harmless. Most people think of it as something in a banana. But your heart runs on electrical signals. Potassium is one of the minerals that controls those signals. When potassium gets too high, a condition called hyperkalemia, it can cause dangerous heart rhythm problems, irregular heartbeat, palpitations. In severe cases, it can stop your heart. I had a patient, a 71-year-old retired teacher, wonderful woman, who came to me complaining of feeling constantly fatigued, lightheaded, and having strange fluttering sensations in her chest. She had been on lisinopril for 2 years. Nobody had ever rechecked her potassium levels after her initial prescription. When we ran her blood panel, her potassium was dangerously elevated. What was she doing wrong? She was doing what many well-meaning seniors do. She was taking a potassium supplement on top of her medication, eating a high potassium diet because she'd read it was good for the heart, and using a salt substitute, which is often made almost entirely of potassium chloride. Here is what you should do instead. If you are on Lisinopril or Losartan, talk to your doctor about having your potassium levels checked regularly, not just once when you start the medication, but every few months, especially in the beginning. Supplement, be cautious with potassium supplements unless specifically prescribed. And please read the label on your salt substitute before you pour it on everything. That little bottle might be quietly overloading your heart. The blood pressure drop that kills. Falls, fractures, and the silent danger of standing up now. I want to talk about something that I have seen destroy the independence of seniors more times than I can count. And it is directly connected to these blood pressure medications. It is called orthostatic hypotension. That is a medical term, so let me translate it for you. It simply means a sudden, dangerous drop in blood pressure when you stand up too quickly. Here is what happens. You are lying in bed. You have been there all night. Your blood pressure has been sitting low and stable because that is what your medication is designed to do. You wake up in the morning, supplement, maybe you need the bathroom, and you swing your legs over the side of the bed and stand up quickly. In those first few seconds, your blood pressure drops sharply. Your brain doesn't get enough blood. And before you know what is happening, you are dizzy, your vision goes dark, and you fall. Amlodipine, in particular, which is a calcium channel blocker, is well known for causing this. Lisinopril and Losartan can do it too, especially first thing in the morning or after a hot shower or after exercise. I have had patients who fractured their hip because of a fall like this. And I want you to understand something. For a senior, a hip fracture is not just painful. It is often the beginning of a very dark decline. Studies consistently show that a significant percentage of elderly adults who suffer a hip fracture never return to their previous level of independence. Some never walk normally again. The mistake people make is they stand up fast, maybe because they are groggy, maybe because they forgot. Shooting, or they take a hot bath right after their medication and wonder why they feel faint getting out of the tub. What you should do instead is practice what I call the 3-step rise. When you wake up, sit on the edge of the bed for 30 full seconds before you stand. Let your body adjust. Let your blood pressure stabilize. Then stand slowly. And if possible, hold on to something stable for the first few moments. Do the same after hot showers, after meals, after any long period of lying down or sitting. This one simple habit could literally save your life or save you from losing your independence to foods and drinks quietly. Making your medication work against you. Most people don't realize this until it's too late. What you eat and drink while on blood pressure medication can either supercharge those pills or completely cancel them out. Nobody hands you a food guide when they write you a prescription. Let me give you the big ones. Grapefruit. If you love grapefruit, grapefruit juice, grapefruit segments at breakfast, anything grapefruit, and you are on amlodipine, we have a serious problem. Grapefruit contains compounds that interfere with the enzyme your liver uses to break down amlodipine. Supplement. When that enzyme is blocked, the medication does not get processed properly. Instead, it builds up in your blood at levels far higher than intended. That can cause dangerously low blood pressure, severe dizziness, rapid heartbeat, and flushing. I have seen patients come into my office with symptoms that looked almost like a medication overdose, and the culprit was nothing more than a glass of grapefruit juice every morning. If you are on amlodipine, avoid grapefruit entirely, not just in moderation, entirely. Ask your doctor or pharmacist to confirm this for your specific medication. Next, alcohol. I know. Many of my patients tell me they only have a glass of wine with dinner, and I am not here to lecture anyone about lifestyle. But alcohol lowers blood pressure on its own. Combine that with a blood pressure medication, and you have a recipe for a dangerous drop. Dizziness, falls, fainting. On top of that, regular alcohol consumption can actually raise blood pressure over time, working directly against what your medication is trying to achieve. If you choose to drink, be honest with your doctor about how much and limit it, especially in the evening when your blood pressure is already trending lower naturally. And then there is caffeine, coffee, strong tea, energy drinks. These can cause temporary spikes in blood pressure that work against your medication. They don't necessarily make your medication dangerous, but they can blunt its effectiveness, especially if you are drinking multiple cups throughout the day. What should you do? Drink plenty of water. Dehydration concentrates your medication and can cause blood pressure to drop too low. Eat a diet rich in vegetables, lean proteins, and heart-healthy fats. And most importantly, tell your doctor everything you eat and drink regularly. I cannot prescribe properly if I only know half the picture. The dry cough that never goes away, and the medication switch that changes. Everything, let me ask you something. Are you taking Lisinopril, and have you developed a persistent, dry, nagging cough that just will not go away no matter what you do? You have tried cough drops. You've tried allergy medicines. Maybe you even went to see your regular doctor and they treated you for a respiratory infection that you never actually had. If that sounds familiar, I need you to listen carefully. See, cough is not a coincidence. That cough is almost certainly your medication. ACE inhibitors like Lisinopril work by blocking an enzyme in your body. Side effect of that blockage is that another substance called bradykinin builds up in your airways. And in roughly 10 to 15% of patients, sometimes even more in certain populations, that buildup causes an irritating, relentless, dry cough. It is one of the most common reasons patients stop taking their blood pressure medication entirely. And I completely understand why. A cough that never stops is miserable. Here is what I've seen destroy lives when it comes to this issue, and I mean that sincerely. People stop their medication without telling their doctor. They just get so frustrated that they quietly stop taking the pill. And then 3 months later, they are in the emergency room with a blood pressure of 200 over 110. Or worse, they are recovering from a stroke. Please do not do this. If you are experiencing a persistent dry cough and you are on Lisinopril, there is a very straightforward solution. Losartan, the RB medication, works through a different mechanism and does not cause the same cough. For most patients, switching from Lisinopril to Losartan resolves the cough completely within a few weeks, with no loss of blood pressure control. It is one of the most common medication switches I make in my practice, and it is almost always successful. But you need to have that conversation with your doctor. Do not suffer in silence. Do not stop your medication on your own. Pick up the phone, call your doctor's office and say, I've developed a persistent cough since starting Lisinopril. Can we talk about switching to something else? Those words could transform your quality of life. The kidney connection. How your blood pressure medication affects the organs you need most. This next point is one that does not get nearly enough attention, and I consider it one of the most critical pieces of information for any senior taking these medications. Your kidneys and your blood pressure are in a constant conversation with each other. Supplement. When blood pressure goes up, over time it damages the delicate filtering vessels inside your kidneys. And when your kidneys are damaged, you cannot regulate blood pressure properly, which makes the problem worse. It becomes a dangerous cycle. Now, here is the good news. Medications like Lisinopril and Losartan are actually very protective of the kidneys when used correctly. Supplement. They are specifically recommended for patients with early kidney disease or diabetes because they help protect that delicate kidney tissue. This is genuinely one of the most important benefits of these medications. Supplement, but and this is the critical part that most patients are never told. These same medications require regular kidney function monitoring because while they protect the kidneys in most people, in some individuals, particularly those with already compromised kidney function, they can sometimes put additional stress on the kidneys, especially if the person becomes dehydrated. I have seen this mistake destroy lives. A 74-year-old man, a former contractor, strong as an ox his whole life. He was on Losartan, which was appropriate for him. But during a summer heat wave, he was working in his garden, not drinking enough water, sweating heavily. He became significantly dehydrated. And in his dehydrated state, his Losartan pushed his kidney function down sharply, a condition we call acute kidney injury. He came into the emergency department in bad shape. His kidneys were struggling. And the terrifying thing is, it could have been avoided. What should you do? First, if you are on Lisinopril or Losartan, make sure your doctor is checking a blood panel, specifically your creatinine and eGFR, which are kidney function markers, at least once or twice a year. Second, stay hydrated every single day, especially in summer, especially if you exercise. Seniors do not always feel thirst the way younger people do, so drink water on a schedule, not just when you feel thirsty. If you ever develop diarrhea, vomiting, or significant illness where you are not keeping fluids down, call your doctor immediately. Those are situations where your medication may need to be temporarily adjusted. Timing is everything. When you take your medication can matter as much as the medication itself. I want to share something with you that changed the way I counsel patients on blood pressure medications. And it is something most people have never even thought about. Blood pressure is not the same at every hour of the day. It follows a natural rhythm. For most people, it is lower during sleep and rises in the early morning, peaking roughly between 6 and noon. This early morning surge is one of the most dangerous windows of the day. A significant number of heart attacks and strokes happen in those first hours after waking. Not a coincidence. That surge in blood pressure is a real physiological event. Now, most people take their blood pressure medication in the morning. And for some medications, in some patients, that is perfectly appropriate. But research and clinical experience suggest that for certain patients, particularly those whose blood pressure does not drop enough during the night, which we call non-dippers, taking blood pressure medication in the evening or at bedtime may actually provide better around-the-clock protection. The mistake most people make is they assume that when they take their pill does not matter as long as they take it, supplement, and they assume that taking it in the morning means they are covered for the most dangerous time of day. But if the medication peaks and partially wears off by early evening, it may not be giving you full protection during that dangerous early morning surge. This is not a reason to change your medication schedule on your own. Please, do not do that. But it is absolutely a conversation worth having with your doctor. Ask them, given my blood pressure patterns, is the timing of my medication optimized? That single question could improve your protection significantly. And above all else, consistency. Whatever time your doctor recommends, take it at the same time every day. Blood pressure medication works on a steady state principle. Skipping doses, taking them at wildly different times each day, that creates gaps in your protection. And in those gaps, your blood pressure can spike dangerously, silently. I want to take a moment and step away from the clinical information just for a minute. And I want to speak to you not as a doctor, but as a fellow human being. Most of you watching this are not just living for yourselves. You are living for people who love you. Children, supplement grandchildren, a spouse or a partner who still reaches for your hand, friends who count on you to be there. High blood pressure is called the silent killer for a reason. It does not announce itself. It does not give you a warning. It quietly, relentlessly damages your heart, your brain, your kidneys, your eyes, day after day, while you feel perfectly fine. And then one morning, everything changes. A stroke, a heart attack, a fall that leads to a fracture that leads to losing the independence you have worked your whole life to maintain. I have sat with families in hospital waiting rooms. I have looked into the eyes of spouses who are terrified and confused, asking me, how did this happen? He was on his medication. And I have had to explain that taking the medication is just one part of the picture. Knowing how to take it, what to avoid, what to watch for, when to call your doctor, that is the other part. It's the part that so many people never get. You are watching this video right now because you care, because you are the kind of person who takes their health seriously. And that matters enormously. And not let the information I have shared with you today sit idle. Take it into your next doctor's appointment. Write down your questions. Advocate for yourself. You deserve a doctor who explains things clearly, checks in on you properly, and treats you as a partner in your own health, not just someone to hand a prescription to. Your health is not just a medical matter. It is the foundation of every experience you still want to have. Every birthday, every holiday dinner, every moment of watching your grandchildren grow. Protect it like it is the most valuable thing you own, because it is. Now, before I close today, I have a few things I want to ask of you, and they will only take you about 10 seconds. If this video gave you information that you did not have before today, hit that thumbs up button right now. It sounds small, but it tells YouTube that this content is valuable, and it helps me reach more seniors who need to hear exactly what you just heard. Every like genuinely helps. And if you are not yet subscribed to Longevity Lane with Dr. Mandell, subscribe right now. Ring that notification bell, because every week we are bringing you the health truths that most people only discover when it is already too late. Your health depends on this information, and I am not going to stop sharing it. I also want to hear from you in the comments below. Have you experienced any of the side effects or issues we talked about today? What did you learn from this video that surprised you the most? I read your comments. Your stories matter both to me and to the thousands of other viewers who may see themselves in what you share. And if you have a family member or a friend who is taking blood pressure medication, please share this video with them right now. You might be sending them something that changes the course of their health. That is not an exaggeration. That is exactly the kind of impact this information can have. Let me leave you with this. Taking a blood pressure pill every morning is an act of responsibility. But understanding that pill, knowing its risks, its interactions, its requirements, and its potential, that is an act of wisdom. In over 40 years of medicine, the patients I have seen thrive the longest are not always the ones with the best genes or the easiest circumstances. They are the ones who asked the right questions, who refused to be passive about their own health, who treated every piece of information as a tool they could actually use. You now have that information. Use it. I am Dr. Mandell. This is Longevity Lane. And I will see you in the next video where we continue to reveal the health truths that give you more years, more strength, and more life. Take care of yourselves and take care of each other.